And so now I'd like to introduce Dr. Sophie Scomps. As many of you know, Sophie has served this community for over 20 years as an emergency room doctor and a GP in a local practice in Narrabeen. She's also been a community volunteer herself at Little Athletics and by founding the sustainability group Our Blue Dot and the democracy group Voices of Mackellar. Now she's stepping up to run as our independent voice for Mackellar. Please welcome Dr. Sophie Scomps.
Thank you. So welcome everyone, and thank you so much for joining our health panel discussion tonight. It's great to have you all along. I'd like to start by saying what an honour and a joy it has been serving this community for the last 15, 20 years as a doctor. And now I want to take that role of being an advocate for the community and caring for the community to the next level. And I want to do that by being your federal member in Parliament as an independent. So I'm looking forward to being your voice in Canberra on the unique health needs of our community here. But I also want to be a strong advocate for health and well-being for all Australians. So I'm going to introduce our panel tonight. I'm joined here by Professor Graeme Stewart, second from the end, Order of Australia. Professor Graeme Stewart is a clinical immunologist at the Westmead Institute for Medical Research and Professor of Medicine at the University of Sydney. Graeme is a Northern Beaches resident and member and honorary doctor at Whale Beach Surf Lifesaving Club for the last 40 years. Thank you, Graeme, for being here. Just to my right here is Dr. Kate Charlesworth. So Kate is a specialist public health physician who lives and works in Northern Sydney. Kate has previously worked as a hospital doctor before undertaking much of her public health medicine training in the UK. Her main interest and expertise is in climate change and health, and she also has a PhD in this subject. Thank you for being with us today, Kate. We have Robyne Brown on the end there in the blue. Thank you, Robyne. Robyne is a registered nurse and she's branch president of the New South Wales Nurses and Midwives Association. She's been living here very luckily on the Northern Beach for the past 22 years, and she's worked at North Shore and Mona Vale hospitals before being transferred to Northern Beaches Hospital. Thank you for being with us. Thank you, Robyne. And last but not least, we have Dr. Cybele Day. Thank you very much for being here. Cybele is a child and adolescent psychiatrist who works at the Sydney Children's Hospital Network. Dr. Day, Cybele, is collaborating on research with the University of New South Wales, and this research is focused on the impact of climate change and heat waves on mental health. And Cybele has also co-authored several peer-reviewed articles on this topic. So please welcome all our guests. So Graeme, I'll start with you. I'd like to open the panel discussion today by talking about the burning question of our time, or the burning issue of our time, I should say, and that's Australia's pandemic response and planning. So Professor Graeme Stewart, as a clinical immunologist, I know that you have a very keen interest in immunisation. So we would love to hear from you about how you feel Australia is faring on that front with the immunisations for COVID. But we'd also like to hear from you more broadly how you think Australia has performed with managing the COVID pandemic, and what lessons you feel that we should learn as we go forward from here. Thank you.
Thanks, Sophie. And look, before I start, thank you very much for the opportunity to speak to and listen to my community. I'll start with the broadly and with some scores. I would give the Australian people throughout this pandemic 9 out of 10. We always knew we were remarkable people, but this gave us an opportunity. Yes, there were a few who didn't perhaps behave in the best they could, but overall I think we've been absolutely extraordinary. It's 9 out of 10 because there are too many people who didn't get vaccinated. I'm going to come back to that. To the state government, under a previous Premier, I think we were probably a 6, 7, even maybe a little above that. And that was because we heard constantly from public health leaders, not enough from clinicians, I must say, and we had a feeling that the public health imperatives were driving the way in which we went forward. After December 15, I would give the state government 2 out of 10, and I'm being generous because I think that was a disastrous decision to allow so many people unvaccinated and many others. I'll come back to that. For the federal government, I couldn't give them any more, maybe 2 out of 10. And that's because of the failure to establish appropriate isolation facilities, for quarantine facilities. Of course, the shambles with the slow start to vaccination, and then a whole range of rollouts after that. I don't want to go over things that people already know. So let me come back to the issue of immunisation and why I think that we only get a 9 out of 10 with the immunisation rates. People will say, but over 95% of people over the age of 16 have become vaccinated. And at one level, that's a good number. Of course it is. And maybe other countries have done not as well as that. But then you look at the US, well, what do you say about that? But when you look underneath those figures, in the age group of 18 to 39, it's about 87 to 88% double vaccinated. And they're the most mobile group. That's 1 in 8 people. 12.5% is 1 in 8. So on December the 15th, 1 in 8 young unvaccinated people were off to nightclubs. I can promise you that the over 70-year-olds don't go to nightclubs very often, at least not in my social set, but they were the mobile groups. They weren't bad people. They just thought that if that's what the government says I can do, I can go off and do it. That just gave enough time to be infected to have Christmas lunch with the parents, and then perhaps go and visit Granny in the nursing home that day, already infected. So that was a shame. The second thing is that we're only at about 53% of people in that over 16 and over age group that have had their 3rd dose, and that is so important. One of the reasons I entered this debate, because as a clinical immunologist, all of the diseases which impact upon this issue of whether people, for medical reasons, couldn't get vaccinated, all those disorders are immunological. All of the side effects of the vaccines are immunological. So in an interview on ABC Radio last year, I said that people who can't be vaccinated on medical grounds don't exist. In truth, we have found about 500 across Australia who have got permanent medical exemption, and probably about 450 of those could have been helped with a clinical immunologist and allergist to get vaccinated. That was 0.003%. So if you exclude those who can't be vaccinated on medical grounds, you're really still looking at 99.997% of the population. So I don't think 83% of that mobile active group was good enough. I think there should have been much more public education about how to get that group and how to get to them. We do know that when we got the Delta wave, that took hesitancy down from nearly 30% down to less than 9%. But Western Australia has done as well as we have with no infection. It isn't just about that. We didn't do well enough, I don't believe, in coming across that. And if you say, oh, well, look, 87%, that sounds pretty good. If we had 1 in 8, which is what it is, who decided to ignore the 40-kilometre zone outside schools and just drove at whatever speed they wanted, and of course they knocked over and killed a kid and the odd granny picking their young child up every 2 or 3 days, we wouldn't say, oh, but don't forget 87% of people do obey the 40-kilometre. We wouldn't call that living with car travel. So my message for the future for vaccination is that we have to keep pushing on with picking up that percentage who never got vaccinated in the first place. That includes those who become infected. You get transient immunity for 4 to 6 months from being infected. The immunity you get from being infected is somewhere between getting 1 and 2 shots of a vaccine. It is less than 2 shots. We have very clear evidence on hospitalisation on that, so that everybody who is infected but unvaccinated should still get vaccinated, leave it about a month and then go through the full program. And we really do have to push very hard on getting everybody through to 3 doses. We hear a lot about vaccination rates. What you need to know is what is the immune protection rate within the community. They are not the same thing. They are for the first few months after your vaccination. They're not after that. I think I'd go on for the next an hour and a half. So I better stop at that point.
Thank you.
Thanks.
We do have a lot to get, but thank you. It is fascinating. Absolutely. And so Robyne, thank you, Graeme. Robyne, I'll turn to you now. We've seen the recent nurses' strike, and we absolutely know that it takes a lot to push nurses and midwives to take that type of action. So we would love to hear from you about how nurses and midwives and hospitals have been faring both through the pandemic and prior to the pandemic, because we know a lot of the issues that are concerning nurses are chronic issues. So Robyne, could you please tell us a bit about the issues that are concerning nurses and what responses you would like to see?
Thanks, Sophie. Thank you for having me. Before the pandemic hit us, staffing was bad to start off with. And at the association, we've been pushing for ratios for the past 10 years, and no one's listened to us. They have evidence in Queensland where there's mandated nurse-to-patient ratios in Victoria and now in ACT. But our state government just doesn't want to acknowledge that it's going to help. It is saving money because people have a lower length of stay. We don't have so many readmissions or representations, and you have enough staff to keep the staff healthy so that they get their time off. I mean, at the moment with the pandemic, we've got staff off a lot of the time, so we're running short staff. So particularly in the ICU or the COVID wards, the nurses have been doing a 12-hour shift in full PPE, which is the gown, the gloves, the N95 mask, which is not very comfortable at all. It pinches you, it's tight, it pulls your hair out, and then they turn around, you finish your shift, and then they say, oh, can you do overtime? We haven't got anybody to replace you. And being nurses, we think, oh, our poor patients, what are we going to do? We're going to leave them. And so I'll just go outside, have a breath of fresh air, and then I'll come back in and do another 6 hours or until they can find some more staff. So it took this sort of thing for us to walk out on Tuesday last week. And, you know, it takes a lot. And a lot of nurses did not strike, but they voted for the strike. So they were prepared to stay and work while 8,000 of us made it to the front of Parliament House. To get over it, I think we have to just keep pushing for ratios, staff to patient ratios, in order, because we're all in it for our patients. We're not in it, there's no money in it. The money that they offered us, they are, thanks very much, you know, we'll give you a clap and we'll cheer you on and we'll say thank you. But thank you doesn't replace the 2.5% increase that we were offered. And then they said, oh, sorry, we can't afford that, we'll give you 0.3%. So that's just not good enough. And that is why we walked out. It's hard for us to strike, and the pandemic hasn't helped us at all.
Thank you, Robyne. Thank you. Yes, absolutely. We hopefully have acknowledged and understood how important our nursing staff and health staff are during this COVID pandemic, but we also need to remunerate and value the work that you do. So thank you. Yes. So Cybele, I'll come to you. Thank you. We also know that people's mental health, particularly young people's mental health, has really suffered during the pandemic and the lockdowns. And I also know, and I'm aware how overworked people are who work in the mental health sector, and also how overwhelmed GPs can be trying to adequately support the mental health needs of their patients. And lastly, also how there are many families quite desperate and struggling to support their children when they can't get the specialist care that their children need for a time. So Cybele, could you outline for us briefly just how the pandemic has impacted mental health trends in Australia? And also, if you have an idea how you think we can improve access to mental health care services in Australia and locally. Thank you. I don't know. Thanks very much.
Thank you very much for having me and for the opportunity to speak about this topic, which is I think, is really important. So in terms of the impacts on mental health of the pandemic and the associated social impacts and school lockdowns, there has been a very significant impact, and I think probably everyone here has heard something about that. In terms of what's happened with children and adolescents' mental health, there's actually been some pretty clear research looking at that. In fact, even in Sydney, looking at the Children's Hospital Network presentations to emergency departments, and essentially at each period where lockdown has ended, there has been a big increase in the number of children and teenagers presenting with serious mental health problems, and that has been of the order of about 40 to 50% increase, and that's continued. So there's been a very big increase in mental health distress that's serious enough to lead to people coming to hospital, particularly in school age and teenaged people. And in terms of the sorts of things that have gone into that, the impacts of social isolation have been worse over the period of the pandemic, the shutdowns, the school disruptions, and a lot of young people actually haven't returned to school. So not only has there been the loss of time, the loss of social contact, for some people school is the safest place in their life, and actually not having access to that, both in terms of community and contact with other young people and teachers and their friends, as well as the impact of not getting the education, are all kind of layered on each other. So the social isolation, the disconnection has all been very significant. And the other impacts are the impacts across the broader society. So when there is economic difficulties, when there are problems for people's businesses and parents' work, etc., parents' stress levels, that has a flow-on effect. So all of those things have been harder over this last 2 years. But what we also know is that actually in terms of the trends longer than that, that actually children and teenagers were presenting with mental health problems increasingly over the 10 years before that. So about 7% increase per year from 2009 until the present. And that's also been seen in the Northern Beaches area, and there's been particularly an increase for teenage girls. And one of the things that people are perhaps less aware of is while overall mental health difficulties and serious distress are more common or more often experienced by people who are otherwise disadvantaged in terms of access to education or poverty or homelessness, and also particularly people from a First Nations background. All of those groups have been impacted, and in addition to that, in more advantaged areas, including in Sydney, teenage girls seem to have been affected particularly over the period of the pandemic, and also were the group that was increasing more in the years before that. And I guess the thing that, in terms of improving access and moving on to sort of thinking about how do we move forward, there have been some positive steps looking at what are those gaps that are happening between people needing help and getting help. And certainly there have been some initiatives at a state government level around improving access to mental health care and safeguards teams, which are working on that. And we really do want to see more coordination and more work between services at a federal government level as well. The other thing I just want to mention, sorry, I know I have to stop soon, is that one of the factors that people are really probably less aware of, but is really coming out in the research now, is that 7% a year for the 10 years beforehand that has multiple factors. One of the factors that's becoming clearer is the impact of climate change, and particularly the impact of hot temperatures. And that's very relevant on the Northern Beaches, because when you have heat associated with humidity, you get more mental health distress. So you get both people becoming more distressed who already have whatever challenges that they're facing, but you also have people who hadn't necessarily experienced significant mental health distress, experiencing it in the context of the stress on your system of being in a hot temperature, especially where you can't cool down and it's humid. And in terms of how do we address this, there's lots of things we can do to start improving the risk factors and reducing the reasons why people are at increased risk of mental health distress, things like getting schools back in place, addressing the economic challenges, and also taking action in terms of climate change is all going to make a difference, as well as improving that coordination of services and planning for the increased need for services that we now know is going to happen over the next decades. Sorry, thank you.
Thank you. Yes, mental health and youth mental health is definitely a huge issue for us here on the Northern Beaches. In the kitchen table conversations, it came up time and time again, so thank you. So as you know, up until recently, I was a GP in Narrabeen, and every day that I went to work, I absolutely did my best to look after and take care of my patients and to advocate for them. And it's a job that I absolutely love and value very deeply. But I have to say, over recent years, I've been had this growing sense of unease that as somebody who's intent on looking after the well-being and health of my community, there was a burning issue that we were ignoring and failing to address, the biggest issue for health, and that thing is climate change. That thing is climate change, and so climate change has been labelled as a health emergency by the Australian Medical Association and the British and American associations and many other professional health bodies. And the World Health Organization has said that climate change is the biggest threat to human health that is facing humanity. So Kate, I'll turn to you. As a public health physician with expertise in this area of climate change and health, I was wondering if you could outline for us some of the impacts that climate change and the burning of fossil fuels has on our health. Thank you.
Yeah, sure. Thanks, Sophie. And it's really interesting to reflect on your story, actually, because it's quite similar to mine. You work as a hospital doctor, and you're thinking about, how can I most add value? What is the most useful thing that I can be doing? I got interested in obesity and tobacco control. And then, of course, as you've said, climate change, which is, the World Health Organization has said this is the biggest issue for our time. And your question is a good one, because you actually refer to fossil fuels. And that, of course, is the key, the root cause. There was a big piece of research that came out of Harvard University last year that found that fossil fuel air pollution, so air pollution from coal and oil and gas, is responsible globally for more than 8 million deaths every year. That is the same number of deaths from cigarette smoking. Right? So fossil fuels are the new tobacco. And in Australia, the figure's about nearly 6,000 Australian lives every year from fossil fuels. So, that's the first issue, and that's an immediate health impact that we could actually fix now. But I often say there's like a double whammy from fossil fuels. There's those immediate impacts, but there's also, of course, that fossil fuels are driving climate change, and that has a whole range of health impacts. Extreme heat is one, that's the #1 climate health risk for most urban populations in Australia, but also bushfires and bushfire smoke, storms, floods, droughts, mental health impacts, really significant and growing risk, rising rates of allergens, shifts in infectious diseases. So there's a whole range of things that we could talk about, if we had the time. But I think the key thing, I'm a public health doctor, and the thing that really gets to me is that climate change is not, it doesn't invent new diseases. It's a threat multiplier. It exacerbates and worsens so many of the existing health problems that we have. And the key thing is that it's an issue of health equity. Okay? It is the most vulnerable people in our community. It is babies, children, the elderly, people who live alone, people in low income communities, Aboriginal communities, people with disabilities. Those people are the ones who are being hit the first and the hardest. During a heat wave, it's not sort of wealthy people, who can afford air conditioning and who, live in the harbourside homes. It's people who are on low incomes, it's children and babies, people who are living in low-income housing, who can't afford air conditioning. They're the ones who die during heat waves. So it's quite a significant issue of health equity and of social justice.
Thank you. Yes, big issue. Thanks, Kate, isn't it? Cybele, do you think, I just was going to ask you, I know that you're doing that incredible research in collaboration with the University of New South Wales, and that's the impact of climate change and heat waves on mental health. Would you like to explain that a little bit more? That would be great, thank you.
Thank you very much for the opportunity. Yes, I'd be very happy to do that. So I have to say, I got carried away before and started talking about some of that, but I think it's something that people really often, when you start to think about it, people realise that people do often experience increased difficulty sleeping and stress when things are hot, but people often not aware of the extent to which that's actually changing in the world and that that's having an impact on mental health. So the evidence about that is now really very clear. There are big studies looking for many years at a number of really serious outcomes. So one of the other things I guess I wanted to just say before I go into that is that thinking about this, being aware of the impacts of climate change and of aspects of it like heat waves and extreme events on mental health can be stressful and distressing, and it's actually appropriate to be worried and concerned when you hear about those things. So I guess I just want to make a comment that there are some really great resources. So if those kind of topics are bringing things up for you, which is actually often a healthy and appropriate response to hearing about a real serious health problem and broader problem, there are some really lovely resources available for people to be able to look at what's going on when you're hearing about it and find out good ways of connecting with others and coping with it. So some of the resources are, there's an organisation called Psychology for a Safe Climate that you can look up that has some really good resources around that, and the Climate Resilience Network. The other thing I wanted to say is in talking about things like serious self-harm and particularly talking about suicide, that can bring up a lot of things for people. It's a very confronting and challenging area to talk about, but it is one that we as a community and as a people we need to be thinking about, because it's so important in terms of prevention and in terms of understanding how we can help people to make that happen less and help families when that does happen in the situations where it hasn't been possible to avoid it. So if you're watching at home, or if you're someone for whom this does bring up challenging issues, feel free to take a break, walk out for a minute or turn it off and come back in 5 minutes time when I definitely have to have stopped. And the other thing is, if it does bring up issues for people when they're listening and thinking about this, there are resources out there. So please look to things like Lifeline, Kids Helpline, and you know, your emergency departments have lots of things on, but they are still there for people when there is no other solution that can help you stay safe. Okay, having said all of that, there are some really important things that we do need to be engaging with and thinking about. So we now know that when people experience temperatures that are hotter than is usual for where they are, so unusually hot weather, especially when it's associated with humidity, and when it goes on for several days at a time, particularly when it doesn't cool down at night, is associated with increased mental distress. It's associated with increased family violence. So actually people's risk of domestic violence and family violence goes up, and other kinds of physical conflict, and the risk of people becoming so distressed that they're suicidal and more likely to actually die from suicide. All of those things are increased by heat. And it's really one that people are not yet that aware of, despite the fact that there's now very good evidence for that. So when you look at it, the increase in rates of calls to helplines, the increase in presentations to emergency departments is very clear, and it seems to particularly affect younger people. So teenagers and young adults seem to be particularly impacted. And when we look at rates over the last 30 years of people tragically dying from suicide, particularly women and teenagers and even older children, is the group that seems to be more impacted by heat and humidity, whereas many other groups, things have actually got somewhat better. So there's a lot going on in that sort of field, and there are a lot of other mental health impacts of climate change that are perhaps more obvious, like the impacts after disasters and disasters happening several times in a row. but the heat ones are ones that people are not necessarily seeing. And the opportunity to reduce them, to make sense of them, and to prevent them, but also to help people recover and not get to the point where they can't go on with life, are really enormous and really important. So thank you very much for being here, because actually just becoming aware of it, being engaged, is one of the important steps to doing that, as well as advocating for change in terms of addressing and reducing climate change. So thank you.
Thank you, Cybele. Thank you, Cybele. That's amazing, incredible research that you're doing. So we have sort of been touching on some pretty complex problems with climate change. So Kate, I'd like to ask you about solutions. So what solutions are public health physicians and doctors groups calling for, both inside and outside the health system, to address this dual threat of climate change and of burning fossil fuels?
Yeah, thanks, Sophie. Well, easy. Well, I mean, as a health system and indeed as a society, there's two things we need to do. You need to mitigate, is we need to decarbonise as quickly as possible, and we're also going to have to adapt. So we'll talk about that. But I mean, mitigation, it's not, we need to phase out fossil fuels as quickly as we can. We have now ignored scientists' warnings for decades. We have left this so late now that it's only rapid decarbonisation that is required to avert the worst. And the modelling from Australia, from the CSIRO and others, are suggesting that we need to get to net zero by about 2035. That's what we can do here. So we need a strong 2030 target, and all sectors in the economy: energy, transport, education, health. Health has a big carbon footprint. We need to get our own house in order. Everyone needs to get to net zero. And then to adapt. Because we have left this so late, there are climate changes locked in for decades, and we need to be prepared and resilient for those changes. So that means, for communities, for health systems, looking at what the impacts are, and how can we manage those? How can we be resilient to those? What are the impacts on our communities, on our workforce, on our supply chains, on our infrastructure, and developing plans for that. I mean, I can talk about what we're doing in terms of health, heat, for instance, and other things. But I think from a health perspective, despite this being, as you said, the World Health Organization saying this is the biggest health threat of all, we do not in this country have a national climate and health plan. In our national health long-term plan, climate change is not even mentioned. That is an extraordinary fact, that it's not listed as a national health priority, and there's no national plan to recognise and to adapt this sort of threat. So, I mean, a number of medical colleges, that's what the medical profession, for instance, is doing. 10 medical colleges, the physicians, the surgeons, the ED doctors, the GPs, the obstetricians, all got together and released a report about 2 months ago outlining the impacts of climate on health and on health systems and services. And their number one recommendation was that we need a climate and health plan. So that's a very clear thing that needs to happen. So 2 things: mitigate and adapt. Easy.
Thank you. And I just wonder. Thank you, Kate. I wonder if you've been chatting to Mike Cannon-Brookes, thankfully. So over to you, Professor Graeme Stewart again. So we're just going to turn to a new topic, but one that's very relevant to us here on the Northern Beaches. We have a brand new public-private hospital here, and what I found as a GP is that it's near impossible for patients to access the outpatient services in our electorate. So that is the no-fee specialist services that are provided by public hospitals and typically manage chronic diseases. Professor Stewart, as a previous member of the New South Wales Medical Staff Executive Council, I know that you've been lobbying for decades now for equitable access to healthcare. So I wondered if you could explain for us just what's been happening here, and if you have any suggestions of how it can be rectified. Thank you. Thanks
very much, Sophie. So many issues, of course, and so little time, because I really hope that there's time for questions from the audience. I also worked for 40 years at Westmead Hospital as a head of department. And in fact, 25 years ago, a young Sophie Scomps was my resident, and it was very evident then she was absolutely an outstanding person. It's just such a delight to see her in this role. What when I heard that we were getting my community was getting a public-private partnership, a triple P, for our major hospital, I was absolutely furious. Having worked for 40 years in a great public hospital, I knew exactly what it had to offer. So why did we get it? A very important driver was the state government just doesn't get enough money from the Commonwealth to fund its public hospitals. And that comes back, of course, to what Robyn's been talking about. So let me give you a quick history and some figures. When the original Medicare agreement was struck with the Hawke government in 1984, it was agreed that the Commonwealth would fund 50% of the public hospital system. Through the Howard years, that dropped to 39%, with the difference of 15 to 20 billion per year then being put into supporting the private system, which got better and better and better over that period of time. The Rudd government, but neither side is covered in glory in this, I have to tell you. The Rudd government then brought that, the 50%, I must say, was scrapped by the Fraser government, and then the Rudd government in 2011 brought it up to 45% with an agreement to 50% of all growth. And that's important because growth in hospitals is way above the CPI. The Abbott government scrapped that. So at the moment we sit a bit below 45% and we're getting a cap of about 6% for the growth. In that circumstance, I don't think it was the only consideration, but after being obviously getting egg on their face over the initial days of the Northern Beaches Hospital, they scrapped 5 other potential PPPs. What are we missing out on? We're missing out on a whole range of things, including doing clinical research and clinical trials and training the next generation with an ethic which doesn't just revolve around money. But what we're really missing out on, and I must say the AMA is now running a campaign to get it to 50%. And in case I forget it, I must say that when you hear a politician say, oh, but look how many billions extra, just ignore it. Just say to them, I only want to hear one number from you, 50%. If you're not talking about 50% total, 50% of growth, then I don't want to vote for you. And it's whichever side gets in is going to struggle with that. And what we really need is really strong independents sitting on the crossbench with 20 years of medical going behind them. So Sophie can't get, for patients, there's a large group of people who fall right down a big crack. They're too complex to be managed in general practice. This is with serious chronic disease. They're not sick enough to send to the emergency room and they can't afford the gaps in private practice. Now, the gaps in private practice are charged by decent people most of the time because the rebate has not grown with time. I can tell you, if you worked in private practice full-time and you charged medical benefits only for every patient, you'd pay for your staff and that would be it. So the gaps have to be there, but so many of my colleagues now are just charging unconscionable gaps. And that has to stop. So how do you put a brake on that? You have public outpatients like we had masses of at Westmead Hospital, where staff specialists employed within the hospital, exercising the rights of private practice, see patients as I did. I haven't charged a gap in 45 years as a specialist, never charged a gap, because I had a good salary and I just wanted to look after patients. Without having to get in the way. That doesn't make me morally better than anyone else. I had a good income and a wife who was a doctor as well. So, but we can't get that at the Northern Beaches Hospital because there is no outpatients. I visited, there's 12 little rooms where nurses do wound treatment, and there's no outpatients because the 200 specialists are on the website. Many of them I know, they're excellent people, are all visitors, visiting medical specialists to the hospital. They're not going to compete with their private practice down the road, even if there were facilities. However, there are a lot of younger doctors who would take on part-time staff specialist positions at the Northern Beaches Hospital to do clinics and to do clinical research and to teach the next generation and to generate all the things that I know the great public hospitals have. So my take-home message about all else, and I'm sorry I harangued you about vaccination, but take-home message about all else is look for the politician who promises to fund the Commonwealth contribution to be 50% of the public hospital funding. Thanks.
Thank you, Graeme. Graeme, thank you for that. I've just got another question to add to that. You mentioned that we have patients falling in the gaps of healthcare because of this constant passing of the buck between the state and the Commonwealth governments and where their funding goes. What would you recommend to address that problem?
So this is the split jurisdiction in health between state and Commonwealth. In New Zealand, the UK example, they've got one government doing it. So the system of having the states funding the in-hospital and the Commonwealth funding the out-of-hospital results in the blame game that you've already seen. When doctors like me and nurses like Ron start waving shrouds, they all say, oh no, don't look here, look there. No, don't look over there. There has to be a structure which brings these two together. There was one very briefly in the Whitlam era, that's a long time ago, but I can see there's a little bit of hair the same colour as mine around here, called the Australian Health Reform Commission. And that's what I'm recommending, and I believe Sophie is very much behind this. For the 2019 election, the Labor government said in February that year that they would establish an Australian Health Reform Commission, and of the two highest priorities, one of them would be to increase access to specialists in the public hospital system. They haven't said anything this year, but that's not all that. They haven't said anything about anything so far this year, so maybe one day they will. I really hope they will. But I think that having a medical specialist, and you'll be joined, I hope, by Monique Ryan, who's a head of paediatric neurology at the Royal Children's Hospital in Melbourne, and other really great independents can really start pushing for this. So let's end the blame game. I think sorry I know I'm taking too long, but we learnt during the pandemic how good it was to have a national cabinet, to have people, state and Commonwealth, coming together. That's the first learning. The second lesson was that most of the time they didn't actually do what they said they were going to agree on because there was no mandation on it. So the states went off and did what they felt was best for their people, and I don't blame them for that, and the Commonwealth did what they thought was best for them. A structured system, because COAG has been an absolute waste of time, anyone in health knows that, a structured system which mandates the two halves of the funding for the health system work together for the benefit of people across the spectrum of their needs is absolutely what we need in this country.
So Robyne, let's have a chat about the Aged Care Royal Commission, if you don't mind. The Treasurer has said that there's no way that we can afford to increase pay for aged care workers. So we'd love to hear from nurses and midwives what your response is to that, and also just about the ratios again in the aged care system.
There's no polite way of saying it, but there is money. They just need to redirect it to aged care. And why do we need to? They could afford a Royal Commission and they can afford working parties. Why don't they just send that money to the aged care staff? I'm a little bit passionate, about aged care. I have a strong feeling that the people in aged care are the people who worked their fingers off to provide us with the country and the healthcare system, which is probably the best in the world that we have today. And look at how we're treating them. We're not giving them enough staff. They didn't have enough PPE in the pandemic, and we had such a big death rate of people who didn't have to die from a pandemic. Where's my cheat sheet? For too long, the resources have been withheld from aged care. What we need is 24/7 nursing staff in the aged care sector. The people who are presenting to aged care have used up all the community resources that they have been able to have, and they have to go into aged care, which is more like end-of-life care. So they don't choose to go into a nursing home. Their families have done the best, and then there's this layer upon layer of guilt for the families who feel, oh, poor Nana is now in a nursing home, and all they want is for the best possible outcome for them, and they want them to have the quality of life that they deserve. And the federal government just doesn't see that. And they've got the money. They just choose not to spend it where it's needed. And we need ratios. One of the comments I made earlier was in one of the newspaper things I read, was that the army's been brought in to help staff the aged care sector. The lowest paid person in the army is earning 50% more than the nurses in the aged care system. How is that? These people have worked, and the other issue is that they don't keep permanent staff in the aged care system. So you've got people who have got a mortgage. They've got to work at 6 different nursing homes in order to get enough money to pay their bills. And now the threat of having got COVID and spreading COVID or any disease, the flu, norovirus, anything, between different aged care facilities is at risk. Whereas if they had a permanent job there, they wouldn't need to go around working as temporary or agency staff, because they just need a permanent job. We're all trying to, you know, live our lives, our best lives that we can. But I'll be nasty, killing off the old people is not really what we're here for. And we just need to get the ratios mandated and to go on to ratios. We need a government that is going to mandate it and make it law, that the staff to patient ratios is law. And we won't support anything less. This is what we need.
Robyne, you're absolutely right. Thank you for that. That's incredible. And it is terribly hard to both attract and retain staff in aged care and often nursing as well. So thank you for everything you do, and we'll fight for that. Yeah, thank you. So we've heard about the problems, and we'll just quickly now, briefly before we go to the Q&A, just run through some solutions. So maybe, Robyne, we start with you, and just for a minute, just briefly tell us a couple of the solutions you'd like to see. I think you've outlined a few, but that would be great to summarize.
My main one is the legally mandating nurse-to-patient ratios in all health areas, particularly the public sector, the aged care sector, and more importantly, the private as well, because it's impacting. I mean, we have our beautiful hospital, but as you say, it's difficult to get public patients into the outpatients.
Thank you, thank you. Graeme, yes, I'd love to hear from you. Thank you. What solutions would you like to see to for our healthcare system?
So for the pandemic, which is not over, we will see new mutants and other problems arise at both levels of government. Please go back to listening to public health and other clinical experts and use their advice to form appropriate policies. Where you don't, then explain in a transparent fashion to the community why it is that you're not doing that. And I hope as part of that solution that there are outstanding independents there holding them to that. On the issue of hospital funding and healthcare reform, 50% funding for the hospital, that's an absolute start. For our area, it would be amazing if we could develop an outpatient, major public outpatient service on the site of the Northern Beaches Hospital, and there would be some real difficulties with that. And again, let's have an independent doctor in Parliament keeping them honest on it. Thank you.
Thanks very much. Look, there's a whole lot of things that I'd love to talk about, but I'll try and keep it brief. So in terms of the impacts on mental health, and particularly climate change on mental health, one of the things is people watching this and being here, because actually understanding the connections between climate change and mental health is a really positive step and is going to make a difference. So thank you. And then from there, having leadership where people throughout the community, including but not only young people, teenagers and children, can see that people in positions of authority are taking the threat of climate change seriously and are taking action to protect their health is likely to improve people's mental health as well. So we actually know that young people particularly, but people across the community have been more worried about the impacts on health of climate change than they were about COVID-19, even in the midst of lockdowns from the pandemic. So there is actually a really high level of distress and concern out there, and a lot of that is understandable and proportionate, but seeing people leading on this is actually a way of immediately improving people's well-being and reducing the chance that they'll end up with more mental health problems. And in addition to that, actually taking the action on climate change, both in terms of planning for the increased health needs that we can no longer avoid, that we're going to see over the next decades, and cutting fossil fuels now. Doing it sensibly in a planned way with leadership, but it needs to be as quickly as we can. And that's really important, and that will make a difference to mental health, as well as this coordination between services and basing mental health services on the best available evidence. Thank you.
And so my message is really just an extension of that. Climate action would have so many benefits for health. It would mean cleaner air, healthier diets, greener and cooler cities, more connected communities, mental health benefits, you know. And so it's a win-win situation. And you put that alongside the jobs and the economic opportunities from a clean transition and from us becoming a renewable energy superpower, and it's a win-win-win. So we just really have to get on with it. Thanks.
Yeah. So thank you all. I think we do have a bit of time for questions. So if you'd like to ask a question, please put up your hand. Is it put up your hand or come to the front? Yes, just please come to the front. Thank you.
Yeah, hi there. My name's Justin. We were caught in London just before complete lockdown. How do we avoid the new variant, and how do we get Australians back safely in that circumstance, like we were in 2020? The best way possible.
Multiple questions within the one question. The first thing is that we are in a circumstance now where we have access to a quite effective antiviral drug called Paxlovid, made by Pfizer, and now becoming available in general practice. That's a game changer compared to 2020. If your question is, and the second thing is, of course, is that people coming back really must be triple vaccinated, and that's now become a requirement, I think. If your question then beyond that is what should we do for quarantine, is that what you were asking, for people coming back? I think there's, I'm an immunologist and I speak as an expert when I speak on immunological things. That's not immunological, doesn't stop me from having an opinion, but now it's not an expert opinion, it's a personal opinion. I would have thought continuation, and the second thing to add is that there is a difference between the public health directives that mandate activity and advice from public health officials. So, for example, Kerry Chant is still saying, please wear masks if you're in an area where you can't keep a distance from. But the government is saying, we're not going to mandate that, and that's their choice. They're probably not quite as honest in saying, but we're getting advice from the public health, but that's a secondary issue. If I personally was coming back from overseas in that circumstance, I would probably isolate for a week or something like that, and I would make sure that I did a rapid antigen test before I came in contact with anyone. It's a matter of who you come in contact with. So if you have friends and family who have a serious illness and known to have immune compromise or other risk factors, well, you'd have a different approach. I think we're getting close to the stage where there'll be no mandatory quarantine, but I think it just makes sense. All else fails, common sense usually is a pretty good approach.
It's really around messaging. So basically, scientists always have to prove themselves wrong, and there's a whole lot of issues trying to get honest messaging out. We've got Zuckerberg out there sort of corrupting the algorithm, so the messaging for, say, with coronavirus is just, you get 90% of rubbish and the 10% is missed out. And then you've got the media just encouraging that as well. What can you guys do, I suppose, as scientists to get your messaging across? It comes across all aspects of science and climate. If this is a relevant question.
It is. I think just talking about misinformation around COVID and viruses and things like that, We always say it's a good idea to have a strong relationship with your GP, someone that you trust, so that you can go to that person and you know that you're going to get an honest answer. And that's why, you know, the GPs come in, I think. Very difficult on how, you might be able to talk for us how we get our message out about climate change. I think the scientists have absolutely been trying everything possible for decades now to get that message out, but the message has often been commandeered by vested interests, like we saw with smoking and asbestos and all that same thing. It's a similar strategy. So what we want is, we want people like you to get involved and to stand up and have your voices heard. It's so important at the moment. We really do need to get this action on climate change for so many reasons. And it comes down to us is one of the ways that we can get that done, just to get the messages across. Kate, do you have, or Cybele, do you have any other ideas about climate?
Okay. Again, my expertise is around child and adolescent psychiatry and the interaction of mental health and climate change. So I'll give a little bit of a proviso on that. But I think one of the things that I see as really important is being able to focus on the opportunities. So by actually taking effective action based on the best scientific and medical evidence to protect health against the impacts of climate change, we can potentially improve hope and improve well-being for enormous numbers of people in the community. It's very clear from looking at evidence of surveys of thousands and tens of thousands, in fact, of young people and teenagers that actually the distress at not seeing leadership from government is more than 50% feeling betrayed by governments. So actually the flip side of that is by actually seeing effective action and hope for the future, that is really important. And I guess in terms of the messaging, I think looking at those positives that we can gain from taking action effectively now is a really important part of that. And I think for mental health, there's lots of benefits. So we know that having access to green space, having connection with nature improves people's mental health. And that's true across the board, but it's particularly also relevant for people from a First Nations perspective and people who have an even, in many cases, very deep and multi-generational 1,000-year connection to land, sea and air, that those actions can be very positive and have very widespread benefits. I'm probably going on for too long, but I think essentially there's so many opportunities to improve our well-being and the well-being of the future, not just the issue of reducing threat. Yes.
I think one of the saddest examples of how hard it is to get scientific messages through is that 30% of pregnant women are not vaccinated against COVID, despite the fact they have a significant increased risk of dying, as they do with influenza during pregnancy, a much higher risk of miscarriage and a 4-time risk of stillbirth. So how do you get that message through, and how do you overcome the social media pressure? I've got no idea. Can I just toss in that if anyone in the room has questions about concerns about vaccination that fall within the area of a clinical immunologist, I'm quite happy to give my email address to Sophie's team. I'm quite happy to pass it on. I've answered dozens and dozens of emails as an immunologist with a bit more time now. I've retired from clinical work. Because almost all the people that are hesitant are very good people who have just got the wrong information. They just need to hear it from an expert who listens and who at least gives the appearance of caring. That starts with the GP, but if the GP is not certain, they can ring a clinical immunologist and get an answer. So it's a genuine offer. If you have questions or know somebody who'd like a question, probably need to live on the northern beaches. No.
Thank you, Graeme. That's amazing.
Hi, my name's Jolene. I founded the Northern Beaches War and Waste several years ago. I actually have a really simple and tangible answer to the question that was asked previously, and I think it's in direct contradiction to what your competitors are doing. And my answer to that is to create joy. Because people are overwhelmed, people are busy, people are tired, people need tangible ways that they can create change. And I think that if everyone in this room and everyone, you guys are already doing it, just banded together with another friend, another person, taught them something, maybe about composting or worm farming or repairing something, or just doing one simple thing with someone else. And while you're there, talk about who you're voting for. But we are going to have an onslaught of fear about China, about the economy. And we've seen that the economy is not being managed very well. We are going to have an onslaught of negativity. And I think our best chance to create change in climate and in health is to create joy and bring as many people along with us as we possibly can. So those micro moments are really achievable for all of us. I'm also in marketing, so the ripple effect, you know. My question is actually for Robyne, because I founded Feed Our Medics at the beginning of the pandemic, and my husband's a doctor, and I saw what was happening with the nurses and the inequity of access to food and I guess finances to be able to heal themselves and their lack of time. So my question to you is about nurse to patient ratios. What can the general public do? How can we make it super simple to understand that we need 1-to-1 in ICU, 1-to-3 in ED, 1-to-4 on the floor? It's very confusing. What can we do to mobilise the general public?
You need to vote for somebody who's going to promise to mandate that change in Parliament and make it law, so that if it's law, they can't do anything else about it.
Okay.
So we just talking to 3 or 4 other people about it, hugging a nurse every now and then because they've had a hard day. There's other ways of giving us a hug. And just, yeah, just talking. And, you know, look out for the association next time we go on strike.
Yeah.
Because they're not going to do it.
Yeah. Thank you.
Another thing I'll just as well add to that is I found it extremely powerful when I was talking to some nurses about what the problems were in the hospital system and why they were needing to strike. And it came down purely to the fact that they were worried about patient safety.
Yeah.
And that's what it comes down to. They're striking because they were worried about the level of care that they could provide to patients. And it's as simple as that. So if we can get that message across, you know, people will pretty quickly understand, I think.
Yes. And for every one patient that a nurse has, it decreases their safety by 7%. Yeah. And it means that there's more readmissions. Yeah. And it means that it's more expensive in the long run. So
there is some good research out from Queensland and also from New York. The New York base was based on sepsis and the Queensland was just on ratios. Yeah. And the other thing is that nurses are also concerned about, we're concerned about giving our patients care, but we also have a duty of care and we also have a regulation board that's watching us. And we can lose our registration if we are found not to have done the right thing. Yeah. So the other reason we're striking is because it usually falls down to us when somebody turns around and says, okay, here's an incident's happened, and here, let's have a look and see who's, you know, it's an Australian thing, let's see who's to blame. Come on, let's do it. But nobody gives you the positivity or, you know, you need the nurse to reach out and say, okay, look, I just need a timeout, I need a day or 2 days off. Yeah. A lot of the nurses at Northern Beaches, I was one of them, was called, well, we were called and asked if we wanted to come back from annual leave because they were short-staffed, which is fine, but we also need our downtime.
Correct.
So we did come, I know a lot of nurses, one of my colleagues came back from Queensland because she works in ICU and they were desperately short there. I'm not ICU trained and I wouldn't even dream of going into ICU because I have no idea. No. But I came up and worked in a field that I'm happy to work in. But yeah, it is hard and that is our downtime. But you know, we know our colleagues are, a lot of the thing was they were all sick with COVID and they just couldn't come in.
Yeah. Thank you so much for your sacrifice, and I'm definitely going to be telling my friends as much as possible about the wonderful work that you're all doing. Thank you.
Hi, I've got a question. My name is Steph. Mostly a question for Sophie. There's been some talk tonight about how slow governments were to react to known public health hazards like smoking, asbestos, etc. As a senior citizen, I have been privy to my GP, with whom I do have a very good relationship, because I've turned 75, I can get this free preventative assessment or examination from my GP's practice. It seems a bit late at 75 to start doing that kind of stuff. I mean, we talk a lot about good health and eating well and not smoking and not drinking and getting lots of exercise, but we wait until someone's 75 before we say, oh, we better assess you in case there's something wrong. So my question is, what kind of money does the government currently give to those kinds of assessments through general practice? And also, what more could they be doing to work on preventative medicine delivered through a general practice?
Thank you. So I should just say that there are actually 40-year-old health assessments as well, usually. So yeah, that's good. Thank you for your question. Yes, prevention should be and is a huge part of general practice. The issue is the time pressure. So every patient that I would see, I would try and slip in some prevention as well. So are you up to date with your, all your screening and all that type of thing? But you're right, absolutely there has to be, definite times in your life that you should come in for those health assessments. And I agree, 75 is too late to try and find out, if there's an issue. But I think also having a good relationship with your GP, who apparently you have, they will pick up things as you go. But yes, I think that more can be done on the side of prevention. It makes a lot of sense, and it would bring down, a lot of the cost in the long run as well. Even though there's some upfront cost, for coming to see the GP, in the long run, it would make a big difference, I think, as well. Has anyone else got anything that they'd like to add to that? No. But you're absolutely right. Prevention is where it should be at. Thank you.
My question is also for Sophie. Thank you for an amazing evening, everybody. I'm asking regarding use of paper in health. So I'm surprised at how many times we're asked as a practice to fax across or reliance on paper. So Sophie, I'm curious as to, do you have any thoughts how we've spoken about the fragmentation of healthcare in Australia, but how can we consider that whole digital bigger picture footprint, preparing for, any future variants like you mentioned, but also it's been a catalyst for us to just think through, how can we do this better?
Thank you. Yes, it's quite extraordinary that I think medicine is probably the last vestige of faxing. Yes. We only got rid of ours, I think, when the COVID pandemic hit. It's quite incredible. People are like, what? You still fax?
Like,
but
no,
it's to do with privacy. Yeah.
We don't want to fax.
No. And interesting as well, telehealth has been in the pipeline for, a decade at least, and never really came about properly for widespread use until it was pushed there by the pandemic. So that has been an incredible boon for medicine and people in rural and remote areas as well, and also just for people who are time pressed, who can't always get in to see their doctor and don't necessarily need to be examined. We can always make that judgment call as well. I think we're finally getting there, aren't we? There are some now that digital communication between specialists and GPs, but it was quite extraordinary up until a couple of years ago, the amount of paper that was used in medical practices. So hopefully we're finally getting there, because I think we're getting there.
Excellent.
Yeah,
we're looking to you to hopefully bring us even better change in that space.
Exactly, thank you. And it's amazing that something like a pandemic has required, been needed to push us in that direction.
A catalyst
Crazy.
for good change.
Yeah, thanks.
And more to come.
Yes, thank you.
My name's Jenny Cullen. I think the pandemic has brought us to such a unique place, and with all the challenges, there's also been these real silver linings where never before has there been such transparency to the public of the development of public health policy. Never before have public health officials been complete heroes and heroines. And I, for one, would love to go to a procession for Kerry Chant and the whole team behind her. And everyone I know feels the same. And so we're at a point where there's this outpouring of gratitude and admiration for people who are behind the scenes, at the same time as it's revealed all the cracks and inadequacies and problems. And always in sort of motivating people, there's this dilemma between emphasising the problems and the outrage and the anger, and the need, as Jolene said, to have some joy and appreciation. And I feel we're at quite a unique moment for health where we've actually got real evidence of both. And there is an upswelling in the community where if we could have some way to channel both the demand for better services and the extraordinary gratitude we feel, and get Kerry Chant and the public health officials out the front of 10,000 people saying thank you. Is there anything in the pipeline that we can support?
Just a quick comment, not that I know of, I'm afraid. I just have to say it's quite interesting. I've been a public health physician for some years, and only really in the last 2 years have I not had to explain to people like actually what that means and what I do. So yeah, no, but I think that would be terrific. I know where they camp out, Kerry and the crew, and they're like 12 hours a day every day. So it has been an extraordinary effort, but from a whole range of people across the system. So yeah.
Can I just say that in Queensland, the Chief Health Officer became the Governor. I'm waiting to see how our government is going to actually reward Kerry, because for a period of time, you might recall, with the change of Premier, she just disappeared off the screen. In fact, I said on a radio interview, she'd become the Peng Shui of Australia. They only brought her out every now and then to prove she was still alive, like the Chinese tennis player. And then after that, she did, not because of me, but after that she was there more often. But I've known her for a very long period of time. She's an outstanding person and really needs proper community. And I'd join your march that you suggested, the Kerry Chant.
Come on, team. We can do that.
I can show you how to march.
Look, they should be thanked. It was an extraordinary what, the public health teams have pulled together and done, and like you said, stood up every single day for months on end. It was extraordinary. So we do need to thank them, and I think that's a beautiful idea. Thank you, Jenny.
Hi, my name is Jill Bruce. For no fault of his own, my husband's had kidney disease all his life, and he was told 14 years ago he would be on dialysis in 6 months. Through diet and everything else, we kept him off until 18 months ago. Now, when the new hospital opened, we went up, looked at the dialysis unit, put his name down. And when he actually did have to go on, he went to North Shore, they train you how to do it. And then we sort of approached Northern Beaches Hospital, which in all essence is not a public hospital, as you say, about the outpatients. And they said, no, we have 12 chairs. Oh, we're running 3 shifts a day now. So that means someone comes in early, someone comes in 11-ish, someone comes in 4 o'clock, and they all have their 5 hours dialysis. No, there's no chance. So put his name down. Now, what do you do if you live in Palm Beach, I live at Narrabeen, or you live at Manly? The only place you can go, there are 2 places. You have private health insurance. You can go to a place at Linfield, private, and pay, or Medibank Private might cover it. The other thing then you can do is go to North Shore Hospital and go there, as you may all know. You go 3 times a week. You have to be there about an hour before, and then you're on dialysis for 5 hours, lying there. And then you come off and it takes half an hour before you can go, and they check you out. So if you go to North Shore Hospital and you live at Narrabeen or Palm Beach, that is a day gone. And there's no way my husband can go to this hospital here. So we were advised to try and fix it at home. So we cut our garage in half and we made a medical room. And so he has it at home. We have had a few nasty turns and things that happened where we had to get ambulance and that. But by and large, oh, he does have a nurse come from Medibank Private. But if there's a problem, then you do need outside help. So when do we get a public hospital on the Northern Beaches? When? That's all I want to know. Mona Vale's there with a lot of land.
Well, nobody should...
my husband's doing quite well. Thank you.
I'm delighted to hear it. Nobody should have to travel more than 30 minutes to dialysis. I was involved with a committee some years ago in which we came up with that. But how do you do that on the Northern Beaches? I'm aware that... Yeah, I know. I mean, I'm aware when I'm at patrol at Whale Beach that I'm, apart from Palm Beach Surf Patrol, I'm the furthest from a major hospital of anyone else in Greater Metropolitan Sydney. And that's assuming the Wakehurst Parkway isn't closed because of flooding. So we have been dudded. We've got a population not that much less than Canberra. And what have we got? On the absolute periphery, we've got a public-private partnership, and we have just been dudded. So what do you do about it? You get the Commonwealth to stump up the money to fix it, because the state doesn't have the money, I don't think, or with great difficulty. How do you get the Commonwealth to do it? Yeah. There you go.
Hi, my name's Bronte. You've mentioned that there has been and will continue to be an increase in the number of people who are suffering from poor mental health, particularly young women, of which I am one. From personal experience, many psychologists in the local area have closed their books or have many months of wait time before being able to take on a new patient. Will this increased demand be met with an increase of mental health professionals in the area? And if so, how is this going to be ensured?
Thanks, Chloe.
I think it's an incredibly good question, and you raise a really, really important issue, that there has been a very significant increase in people's needs over the last 2 years, preceded by years and years of that. In terms of what's happening to try and address that, I think it is really important for people to speak out and advocate. There are people within mental health and mental health professionals that are definitely trying to advocate with government and governments. From my understanding, there is still a lot more to be done. So I don't have a kind of wonderful answer to offer you. I think really making sure that everyone keeps speaking out and pointing out that this is a really important issue, that we do need proper services, is really important. Probably one area where there is some progress is around the provision of care between people reaching crisis point, being in hospital and getting back into the community. So there has been, from a state government point of view, some significant commitment to these safeguard teams. So that is, I think that's a progress, but we do need to do a lot more. The other thing I would say is that there is a lot of opportunity for positive things and prevention, in that while there has been an increase in distress, the rates of people becoming so distressed that they have to go to hospital and the rates of people dying, well, it's obviously still absolutely tragic and awful for any individual in their community when that happens. It hasn't actually gone up to the extent on the Northern Beaches that it has in some other areas. So there are obviously some good things happening, but clearly there's a lot more that's needed. Yes.
Nurse-to-patient ratios in the mental health system and the community mental health system needs to be mandated.
Thanks, Norris. I think this will be our last question. Thank you.
It's a rhetorical question. On the subject of nurses' pay and all of that, how many people here would be prepared to go and wipe someone's ass on a daily basis for $69 an hour? How many people? Put your hands up. So you wouldn't do it for the $23 an hour that they are paid. Think about it.
Thank you, everyone. And I'll just thank you, everyone. I'll just have a little wrap up. So I think the overwhelming picture that we've seen tonight is that we have a healthcare and aged care system that is not being attributed the importance and given the focus that it needs. So we absolutely need people in Parliament who will prioritise health and prioritise care of the most vulnerable people in our society. We need people in Parliament with a vision for what our healthcare system and our aged care system should look like in 10, 20, 30 years' time. And that vision needs to be informed by experts such as we've heard from today. As an independent in Parliament, I will be a champion and raise bills on the issues about the things that you've heard tonight. And this will mean that they become spotlit. We increase the attention in the media and the public discourse around it. And that is a way to help put that pressure on our government from within Parliament and from the public as well. And that's how we get change made. That's what we've seen been happening with the Integrity Bill, and that's what we've been seeing happening with climate as well. We're dragging them there. We're getting there. And then all these independents are popping up. People are not satisfied with what's been happening, and we take it into our own hands. So I believe that having a powerful, I believe it'll be very powerful having a representative in Canberra who is keenly aware of what is needed in the healthcare system, both from a health provider point of view, but also from a patient perspective. I've spent years looking after the health and well-being of this community and advocating on their behalf. And what I want to do now is I want to step up and take that to a much higher level so that we can ensure that we have a world-class healthcare system and aged care system, and actually NDIS as well, that everyone has access to. So we know what the problems are, but we also know what the solutions are. We've heard about them tonight, so it's up to us to get it done. So I thank you all very much for joining us tonight. It's wonderful to have you along, and I particularly thank all our panellists for such an interesting and inspiring discussion. Thank you.